Thank you very much and very good morning to all of you. It isn't so good outside, freezing outside, and it's probably a bit warm inside, probably the warmth of the organizers. Let me provoke you a bit. Someone was asking me whether I was having a cup of tea. What exactly are you doing? A very difficult question to answer for a bureaucrat. What are you doing? We do files and files and files. But what I didn't mention to him that in our ministry we are all in labor, as it were. And by definition we can't deliver. Because if you deliver, you'll be out of labor. We are in Ministry of Labor. So nothing gets done here. So we are perpetually in pain, attempting to deliver, unable to deliver. But we do continue to do something. But we are now doing a scheme called, I don't know how many of you have heard of it, called the Rashtriya Swasthya Bima Yojana. It's a smart card-based health insurance scheme, which incidentally now has become the biggest health insurance scheme in the world, not so much known in India. Because in India, it's only when yoga becomes yoga, it gets to be recognized in the country of its origin. The scheme is gradually becoming yoga, and it's gradually getting recognized in India as well. This is a smart card-based scheme, and probably the biggest model for public-private partnership, because the funding comes from the government. It is entirely technology-based. This is the first ever paperless, cashless health insurance scheme in the world. The world is extremely fascinated by what is happening here, because they can't believe that in the remote parts of this country, each of these 12,000 empaneled hospitals has a gadget which gets all the data in and transmitted to a server. And the payments are also made electronically. So there is neither cash being transferred nor paper being transferred. I was jokingly telling one of the ministers in one of the states who was sitting on the file, sir, isme to koi cash hai nahi tha, file to aap kar diye jaldi se. So unhone kar diya jaldi se, because there's nothing. I mean, everything can be tracked under the scheme. So it's one of the finest examples of not only public-private partnership, but perhaps the biggest user of IT applications anywhere in the world, in the rural settings. Why I'm saying that? Because normally, most of you would be technologists. I'm not. I can barely operate this computer. But as I was telling my dear friend here, that technology seems to have become a fashion with all of us. So we start finding solutions by thinking of technology. My suggestion here would be, and as I said, I'll provoke all of you, would be to look at processes. Technology is an enabler. It helps you. But technology itself does not provide any solution. And we messed up projects after projects after projects. So when someone asked me that, did you do any pilot in this country before you launched this scheme, which is now covering 120 million people with 33.5 million smart cards in the field, a smart card that is now being used also for PDS in Chhattisgarh. There's a lot of talk about other things. We believe that we should make it happen and that talk about it. We didn't go to rooftops to announce this scheme. The scheme is now happening, it is being felt, and that's why I'm talking about it. So there is already a 25 to 30% saving on a health insurance card being used for PDS, and the Kerala government decides to use this smart card for delivery of PDS throughout the state. So the scheme is happening. The platform is now stabilized, the technology platform. It is fairly secure because we have a key management system which ensures that hanky-panky doesn't really happen, but some of the smart LX are proving me wrong. Some of it is indeed happening. But that's the challenge. It's a cat and mouse game. They do funny things, we do funnier things, and we are each after each other. So that is how this technology platform in RSBY is now being used not only for health insurance. A decision has been taken to use it for life and disability cover. We are already using it for PDS. It's gradually expanding. Decision taken to use it for old age pension. This could actually, and this is already, becoming a platform for delivery of social sector schemes. And not only social sector, if you broaden it, when I say PDS, we've also taken a decision to use this smart card for the purpose of housing health-related data. So far, it was an insurance card carrying a credit of 30,000 rupees, which could be used anywhere in the country. And mind you, this is the only scheme in the government where a benefit that accrues to a person in his own district can accrue to him anywhere in the country. So it is the first ever portable platform available to a beneficiary, because a lot of poor people migrate from, say, state of Bihar to Punjab and Haryana in search of employment, and they fall sick there. Now, they can't get the benefit of NREG or PDS in those states, but sure enough, they can get the healthcare. But as this card gets to be used, as it's being demonstrated in Chhattisgarh, the beneficiary has a choice to take his galla, that is food, the grains and the sugar, from any of the shops within that city. So the portability part really empowers him. And I think the USP of this platform is that it empowers the beneficiary to encash his benefit anywhere that he wants in any of the empaneled hospitals. That's the real empowerment. So the scheme seems to be happening. There is immense amount of potential. I'll stop here because I was given 8 minutes and I have already done 7.5 minutes. Thank you very much for inviting me. I look forward to your questions. God bless you.